So blood transfusion. So blood function, blood disorder. And here we're going to talk about the blood administration, right? The blood basically contain two things. One is blood corpuscle or blood cell. Other portion is called liquid. The liquid portion is called plasma. So blood corpuscle, basically red blood cell, platelet, and white blood cell. The liquid portion basically contain the plasma. Keep it in mind, very important. Plasma basically contained different clotting factor, right? So red blood cell transmit the oxygen and nutrition. If deficiency of red blood cell, it is called anemia. Platelet is very important for blood clot, right? If anybody is bleeding, bleeding will be stopped if your platelet be activated. If anybody deficiency of platelet, so the white blood cell basically work as a immune cell or defense system. So if deficiency of white blood cell, infection easily get attacked or patient develop the fever. Fever is the sign of infection, for the infection. So if red blood cell is less, we call anemia. If platelet is less, then bleeding disorder, or it is called thrombocytopenia, right? If platelet is more, it is called thrombocytosis. WBC, when less than normal, this is called leukopenia. If WBC is more than normal, it is called leukocytosis. It is happening in case of leukemia, right? So if patient need the blood transfusion, basically we give fresh blood that contain red blood cell, platelet, and white blood cell. Other name of red blood cell, it is called erythrocyte. Other name of white blood cell, it is called leukocyte, right? In some medical condition, when patient need only blood plasma, right? It depends upon medical condition. So in this picture showing in molecular level where blood transfusion or blood exchange occur. It is the artery. Artery indicate the red because they carry oxygenated blood. Whereas the venous system, they contain deoxygenated blood, means carbon dioxide carry. They carry the carbon dioxide. So this is the artery, and this is arteriole, right? And finally, they met with the vein in capillary level. This is the vein, this is venules, and they met with the artery in the capillary level again. So in the capillary level, basically oxygenated and deoxygenated blood are exchanging. What else? The main focus, we're going to trace out about the blood transfusion or blood administration. We're going to get focus, and I'm going to print something in your mind about Nclex related question, what need for you, right? As we discussed before, the type of blood component, red blood cell, white blood cell, and platelet. So red blood cell, other name is called erythrocyte, and white blood cell, other name is called leukocyte, right? Leukocyte, yeah. So, or WBC, right? So when patient need the blood transfusion, we have to follow some rules and regulation. Okay, so what they are, so keep in mind, sometimes Nclex would ask what must be received before a transfusion to start. So before transfusion of the blood, or if patient need the blood administration, first of all, we need the informed consent by the patient, but it must be signed written consent. Okay, so before blood transfusion, we must have to check the blood type and cross matching. Sometimes Nclex board asks, in order to determine the donor compatibility, what must be done? One is blood typing and cross matching. Don't forget, before blood transfusion, you must check the patient vital sign. So Nclex board sometimes asks, what must be done to determine a client baseline before starting blood transfusion or blood administration? Simply take the vital sign. Okay. Another common question Nclex board asks, I want to recap it before finish my class. How many nurses confirm the unit of blood? How many nurses need to check it? At least 2 RN, right? So after the blood transfusion, always you have to stay with the patient for 15 to 30 minutes. 2 point here, sometime Nclex would ask, how long after blood is removed from the blood bank refrigerator do you have to start it? Within 30 minutes. Another question I said, how long a RN must stay with the client after transfusion is started? At least 15 minutes. Why you have to stay with the patient with 15 minutes after start the blood transfusion? To see the blood transfusion reaction, right? Also, you have to know how many milliliter are in 1 unit of pegged red blood cell. How many milliliter in 1 unit pegged blood cell? About 250 ml, right? So what next? We already discussed, but still it is here. I want to recap. The type of blood component or corpuscle, the third one is the platelet. So sometimes patient need to platelet transfusion, right? In case of thrombocytopenia. So thrombocytopenia means reduce the number of platelet. Imagine a patient has a aplastic anemia and bone marrow does not produce any red blood cell, any white blood cell, and any platelet. And patient develop anemia, leukopenia, and thrombocytopenia. So reduce white blood cell, reduce platelet, and reduce red blood cell, white blood cell, and platelet. And this combination is called pancytopenia. If patient have thrombocytopenia, we have to transmit the platelet. Before platelet transfusion, we must have to check the blood type and cross matching. So cross matching is not required, but usually done. Platelet concentration contain a few red blood cells, but if blood patient need the blood administration, it is a regular routine test routine to determine the donor compatibility, right? To typing the blood and cross match. Platelets are admin rapidly, usually over 15 to 13 minutes, right? Now go for some important talk about the fresh frozen plasma. Fresh frozen plasma, right? As I told you, if your patient need to the blood transfusion, need to transmit, we has to check the vital sign, right? Before. So baseline vital sign are always needed to monitor, right? What are the next, or what are the most important information you have to know for Nclex board? The RN must always be present before blood or blood product administration, right? And also don't forget, blood is verified with or by the 2 nurses, right? So here, sometimes patient need a frozen plasma, so maybe used to provide clotting factor defect. RS factor or ABO compatibility are required for transfusion of plasma product. Fresh frozen plasma is infused after throwing and admin rapidly, usually over 15 to 30 minutes. Evaluation of effective response is necessary by monitoring coagulation studies. Also, we have to check PT and PTT. PT stand for prothrombin time. and PTT for partial thromboplastin time. It is very important for Nclex board. Sometimes ask what are the normal prothrombin time? What are the normal partial thromboplastin time? You must know for Nclex board. So what else? Compatibilities. So client blood sample are raw and level at the bedside at the time of blood sample is drawn. The client is asked to state his or her name and which is compared with identification band or bracelet. So you always check identify the patient. How we have to identify? You have to check the patient name, we have to check the date of birth, and we must check it on bracelet. Don't depend on the patient. If patient has a mental problem, how you can be depends on their answer. Don't go and check the room number as an identification. You do not know. Maybe any other patient came in the room to meet with the patient or client. So always witness may be required according to the agency policy. The recipient, ABO, and RS factor are identified to determine the compatibilities or cross-match must be done before transfusion, the blood product. So here, universal donor, RBC donor or O negative. So keep in mind, measure blood type are A, B, or AB and O, right? So I said measure blood types are A, B, A and B, and O, right? And O. So basically, universal donor are O and universal recipient are AB. Easy way to remember, universal donor, DONOR, and it is O. So there are three O's. O, in donor O, NOR, another O, three O's, right? But recipient, no O at all. AB, universal recipient, right? So keep in mind the safest blood to administer to an emergency if the blood type is unknown is O negative. Understand? So universal donor, I said O, but if you do not know the blood type, in emergency situation, it is safe, give O negative. I am going to recap it. The safest blood to administer in an emergency if the blood type is unknown is O negative, right? So also keep in mind, when you transmit the blood, as I told before, we have to stay with the patient for 15 minutes, right? So again, I am recap it, my friend. If I ask you, what blood type is considered universal and can be used for all other donors? It is type O negative, right? Type O negative. So what blood type is considered the universal recipient and can receive all blood? It is AB positive. It's called universal recipient. Also, it is important you have to know what are the most common infections spread through the blood transfusion. It is hepatitis B. Hepatitis B. In order to determine the donor compatibility, what you must be done is blood typing and cross matching, right? I want to recap something again. What you must be done to determine the client's baseline before starting the transfusion, vital sign, right? So now another point is, keep in mind, when you transmit the blood, we have to let me show you where we are. Here we've done this compatibility donor here. So now here, so after the transfusion the blood, at least we have to stay 15 minutes with the patient to stay the any kind of blood transfusion reaction to check it. So what are the blood transfusion reaction? What are the sign of adverse reaction? Anything you can say. So keep in mind, most immediate or most common sign are patient feel restlessness, nausea, hives, shortness of breath, fever, chill, and low back pain. Okay, low back pain. So this is the most common sign of blood transfusion reaction, right? Now they said transfusion reaction if patient is unconscious. What are the most common? Unconscious. Weak pulses, fever, tachycardia, right? Fever. If fever, as I say, elevated temperature, is same thing, right? Elevated temperature means fever. Tachycardia means increase the heart rate. Bradycardia or bradycardia, they said, hypotension, vision hemoglobinemia, visible hemoglobinuria, or oliguria or anuria. Most common sign and symptom of blood transfusion, most common, I said, back pain, chill, hives, or tachycardia, right? In this picture can help us to memorize the transfusion reaction. You can see A, F, H. A for allergic reaction, F for febrile means fever, and H stands for hemolysis. If I start one by one, allergic reaction. So patient may be anxiety, shortness of breath or wheezing, dyspnea. Dyspnea means shortness of breath. or hypotension, decrease the blood pressure. Allergic reaction sometimes reflects on the face. It is called facial flushing, hives, or rash all over the body. If patient develop febrile, automatically febrile patient go for tachycardia or tachypnea. Tachycardia means increase the heart rate. Tachypnea increase the pulse rate. Fever, chill, or all of this condition increase the anxiety. Also develop the hemolytic change like fever, tachycardia, hemoglobinuria, chest pain, and low back pain. So when patient develop the blood transfusion, what is your first priorities? So what do you do if adverse reaction occur? Stop blood transfusion, stop the blood transfusion, right? So stop the blood transfusion and run the normal saline. That things, I mean, can stop the reaction. Always, if any medical condition, we have to monitor the vital sign, notify the healthcare provider and blood bank, and make sure urine and blood culture are done, right? So keep in mind, sometime Nclex board asks, why? Why must you run the blood at a slow rate? We do it because the running the blood fast can cause the fluid overload, right? So what next? Next is here. So transfusion reaction, something related to what I explained, but I want to read with you. Stay with the client. If the first 15 minutes, stay with the client for first 15 minutes of the infusion of the blood and monitor the client for sign and symptom of transfusion reaction. The first 15 minutes of transfusion are most critical, okay, and also the most likely time of transfusion reaction will occur. Vital signs are monitored every 30 minutes to 1 hour according to the agency policies, right? So there are two questions we have to discuss a little bit here. Let me explain. A client who is received the blood transfusion ring the call bell for the nurse. So a client who receiving the blood transfusion ring the call bell for the nurse. When entering the room, the nurse note that the client is flushed, deep sneak, and generalized itching. So this is the blood transfusion reaction, right? What we explained few minutes ago. So you have to stay with the patient first 15 minutes to check for any kind of blood transfusion reaction like restlessness, nausea, hives, shortness of breath, fever, chills, low back pain, right? Any allergic reaction means itching. It indicates the blood transfusion reaction. What else? A client has a prescription to receive 1000 ml of 5% dextrose in 0.44% sodium chloride. After gathering appropriate equipment, the nurse takes which action first before spiking the IV bag with the tubing, right? Sometimes Nclex would ask, what are the size of IV gauge must be client had? It is 18G, 18G with a filter needle. Whatever, we are here to learn something. We are here to learn some new information. So you have to have a desire of learning. It can help you to step up. So they said what need? A uncapsule distal end of tubing, uncapsule the spike portion, open the roller clamp and close the roller clamp on IV tubing. Okay. Answer is number 4. Close the roller clamp on IV tubing. Explanation is the nurse must clamp the tubing to prevent the solution from running freely through the tubing after it is attached to IV bag. The nurse should next uncap the proximal portion of the tubing and attach it to the IV bag. If IV bag is elevated, the roller clamp is opened slowly and fluid is allowed to flow.